Welcome to another COVID-19 update. This is brought to you by the American Academy of Neurology in collaboration with Neurology Today. And I'm really thrilled to be here today with an old friend and colleague, Dr. Jennifer Bickel. Dr. Bickel is not only on the editorial advisory board of Neurology Today, but she's the employee wellness officer for COVID-19 at Children's Mercy Hospital in Kansas City, Missouri, our old stomping grounds. Jen and I went to med school together. Known each other for 25 years. I don't know what that means. Met when we were 5, right?
I know. I think that was just about it, right? We're very precocious.
Exactly. We started very early. It's really great to be here, and thanks so much. The topic of wellness in the age of COVID-19 is something that's so important. This has been unprecedented. It's having effects not just on the health of millions, tens of millions of people, health on healthcare providers. 10% of the people affected in Italy are healthcare providers. I saw a statistic yesterday, and this is all current stats as of March 25th, 2020, 13% of people affected in Spain are healthcare providers. So it's not just affecting our health, but it's also affecting our wellness, our mental health, our emotional well-being. And Jen, first, can you maybe just define what sorry, we have pets and family members in the background. We're working from home today. I apologize.
This is all new standards, right? I mean, it's interesting because what would have worried us before doesn't really worry us right now, right?
Exactly. It's probably better for wellness working from home. You got your coworkers, you got the dog and the cat and everything else. Anyway, sorry. So talk about wellness. What exactly, how do you define wellness, and really what do you mean when we use that term?
It's interesting because I think that everybody is still always confused about what wellness means. Especially, it's been talked about quite a bit. Does that mean that this is about doing yoga? Is this about doing lavender patches? Or is this about fixing the EHR? Or is this now, the big thing is, how can I think about wellness if I don't have PPE? Right? Right. Don't tell me to relax if I'm not protected. So when I think about wellness, what I think about it truly is that space that we have to improve how we respond to the environment around us, as well as the environment's responsibility to give us to remove barriers and to improve opportunities for us to be well. Right? Wellness does not mean this consistent level of happiness and no worry. That's not human, right? There is no human existence that occurs without some levels of anxiety and stress. And especially in a situation like this, I would actually say that if anybody is going through this in a happy way, that is not wellness right now. Because this is the appropriate time to be worried, to be concerned, and to adjust your life and your priorities because of that. And that doesn't mean that somebody is not well. That means that somebody is adapting to their surroundings in a logical way.
I was talking to a colleague yesterday, and actually one of the folks we interviewed for these broadcasts. He's on the front lines. He's doing a lot of work around this. He's working literally. He said 24 hours. He said something's happening here. Well, 12 hours later, something's gonna happen in China. He needs to be aware of that. And I mean, I said, hey, are you taking care of yourself? And he stopped for a second and said, well, no, not really. I can't. How do you try to get physicians, and we have residents that are working crazy hours and now being redeployed. They may be on the internal medicine service. Our residents are just redeployed to a different hospital within the system in the ICU. This is completely unprecedented. How do you have physicians that are working so hard and need to work, because this is our calling. This is like, I think oftentimes we forget, and hopefully this has been a wake-up call, but like, this is our duty, this is our mission, this is our war. How do you get physicians who are on the front lines, who are burning the candle at both ends, to just stop for a second and say, wait, I need to take care of myself? How can you recommend to do that?
Yeah. So I think that's an excellent question. Anybody who's heard me talk before knows that I say that we doctors have a tendency towards martyrdom already, right? We have a tendency to already sort of self-sacrifice and feel that that's the right thing to do. This is something that's within our culture. This is something that probably, honestly, in order for us to all get through medical school and residency, we're all inherently slightly crazy, right? Like to be able to do that to ourselves. And so what I would say is the fact that one of the terms that I've really come to like is the ethics of self-care. There is unrefutable science that we have to be well in order to not make errors, that we have to be rested in order to have compassion. There's multiple studies that show that our wellness is directly related to the wellness of our patients. And so it is unethical to not take care of ourselves. So when we think that we are actually, by self-sacrificing, helping our patients more, that is actually a selfish, self-soothing attitude because we are trying to move and move and move. It's a little bit of a flip take on that.
Yeah, I just want to stop for a minute and repeat that, because that's I've never heard it phrased exactly like that. It's unethical not to take care of ourselves, and I think, wow, I've never looked at that. I bet most of the people that are watching this video have never looked at that, and that's a powerful statement, because we're trying to help people, but how can you help people like if you're not helping yourself?
Right, and that's the thing, is that the science is ahead of our cognitive switch and our training, right? We still consider it selfish to stop and drink water, right? Like we need that. We are human beings. And so there is not, there is no badge of honor. No longer, let me put it this way, there's no longer a badge of honor of saying I didn't eat for the past 24 hours. Instead, I think that we have to have real discussions with people about how that is not safe for our colleagues or for our patients.
Yeah, and I guess what I would say is, we trained in a time, before duty hours, and, duty hours weren't tracked, and about, trying to make time for oneself. How do you recommend any practical tips all the time and being pulled in many directions? Are there any strategies that you suggest if someone's watching this and says, I guess, okay, I get it. Wellness is important. Okay, I hear you. I don't have the time. What can you do to try to break that barrier?
So I think that one of the biggest things is the whole thing of realizing whenever we say the words, I don't have the time, time is never the part that's negotiable. Time is actually the part, we are the ones who do that. Even when our external environment is falling apart, if you think about the times that we spend ruminating, that is a choice to spend time ruminating instead of doing self-care, right? There are times of the day that we absolutely spend in wasted emotional energy that could be moved to self-care. So I will say that there's probably always opportunities for time, but time is a very easy excuse that we use even in times of not crisis. But what are actual tools that we can do? I was talking to one of our colleagues yesterday, and he's starting to take his conference calls walking around. And so even in this world, he was able to get 8 miles of walking around and taking his conference calls. That's not something I had thought of, right? So I keep coming back and sitting down in front of my computer, and it hadn't occurred to me that the rules don't apply anymore. I could go right outside. We have a walking trail out here. It's cold. I put on a coat. It's fine. I think, the other thing too is that we have to realize that all of us reach a quiet state of mind a different way. So I encourage people to explore it, right? So does that mean, like, you probably know this, but apps such as Headspace and 10% Happier are validated, proven apps, and they are now free to healthcare workers. There is also just the benefit of staying still for just a little bit, putting your feet on the ground and giving yourself the opportunity to breathe and check in with your body and how that feels. I think that I would encourage most people to not try to take on a whole new adaptive strategy, because it's just like doctors do and be like, oh, I'm suddenly going to master this new technique. I think now is really the time to think, what has helped me in the past? How do I do more of that?
So again, you said something that I really want to just call attention to. If the folks didn't hear, Headspace and 10% Happier, these are 2 apps that people can download right now for free. And both of these companies have made the bold and courageous move to say, you know what, we're going to put the betterment of society first over profits. And if you're a healthcare worker, you can use our app for free. And these aren't just like apps where you just say,
Right.
this or do meditate or no. This is actually science. There's science behind all of this. There's actually a ton of science behind it. You know, in my patients, in my practice, I use something called mindfulness-based stress reduction, which has been,
Yep.
shown to improve cognitive health
Yep.
and a cognitive perspective. These apps are actually not just apps. They're rigorously studied things, and our residents are using these, our faculty are using these. So thanks for reminding us about this. And any healthcare provider can do that. For those physicians and advanced practice providers, nurse practitioners, PAs, residents, medical students, you know, and at NYU and you know, I bet in other medical schools around the country, they're literally asking medical students if they want to graduate early, meaning like next week, so that they can join the workforce. You know, and I'd love to hear how things are going in Kansas City. I know there was a death, I think the first death just a couple days ago. I've been following this pretty closely. And you know, New York, for those people that don't think this is a problem, within 48 to 72 hours, New York City is going to be an unimaginable place when it comes to healthcare. There's not going to be beds. There's not going to be ICU beds. Like just like take a step back. If someone has like a stroke or I don't know, something else and they need an ICU bed, there's not going to be those beds. You know, in Italy and in Spain, they're not giving ventilators to people over 80. They're going to give it to a 30 or 40 or 50-year-old because that person's more likely to survive and have more years of life. I hate to say it, but my crystal ball, which I wish I didn't even have to look at, probably that we're going to be put in the same situation, and we're not going to have the resources to care for patients in the United States of America, which is shocking. You're going to have physicians that are up against these like unimaginable decisions, and they feel guilt and sorrow and just. Do you have any I don't know, tips about, you know, when physicians like us are going to be put in these terribly uncomfortable situations, you know, these ethics, there's
Yeah.
the rules are just all broken. Any strategies to go about this?
Yeah, you know, and I think that's you know, I think what's important right now is the fact that there are very, very serious concerns that people have about their own well-being, their own health, their children's health, their parents' health, and also the chaos of everything that's changing around them. And then on the flip side, what I'll also say is that then we also have an entire part of the neurology workforce that now is at home and hearing about these tragedies, but is not affected by it.
Yeah.
So you had asked about kind of Kansas City. I work at a pediatric hospital. Right now, our numbers are actually down, and we've moved all of our ambulatory clinics to either virtual or off-site.
Yeah.
So we're in this kind of waiting period, and
Yeah.
also trying to figure out how do we prepare, right? So there's this anxiety in the quietness, and then there's fear and anxiety within the front lines of everything as well.
Yeah.
One of the things that I would say as far as what you're describing in New York and what I unfortunately might happen in a lot of other places is one of the methods that we're taking here. I learned from one of our emergency room doctors helping to lead the show here. She has done a lot of deployment work, a lot of disaster work as a physician. And so she has helped me to know how they provide well-being support during those times. And so really sort of almost adopting the military model, including things that are called wellness checks, deploying teams that work with the same team every day of either psychologists, social workers, or chaplains that check in every day with our people and make sure that even just the things such as, are you drinking water, right? And understanding truth is that even in times of disaster, most people do not require prolonged mental health services afterwards, but helping them to be able to get through that stage, helping them to realize that if they're emotionally crashing, that is okay, they will be able to get back up. So right now we're working on standardization of those processes.
Great. Well, that's really helpful. When it comes to the pediatric part, and you know, so I have a 4-month-old. She's in the other room. She's sleeping, not
I
crying.
didn't know that. Congratulations.
Thank you. Appreciate it. Took a little
We're all
while.
like grown up and doctors and parents.
I know you like beat me to it by a decade or two. Anyway, so I've been reading voraciously because you know the initial report said, oh yeah, kids are fine, everything's fine. And you know, there was just one study. It was infants between age 1 month to 11 months, and everyone did fine. 2 were hospitalized, but everything. So you know, parents say, okay, well, kids are going to be fine. Let's go in. I'm going in. And then what happens is the new studies come out, and the study from China came out, just, 2,200 people. And okay, the kids, they have a 6%, I think, hospitalization rate compared to a 20% hospitalization rate for adults. So, okay, that's better. But wait a minute, 6% of kids going to the hospital that's not trivial. And there was one death in China of the 2,200, a 14-year-old boy, sadly. And okay, well, one death, well, that's still terrible and horrible, but okay, maybe. Well, I don't know that that's really the case here. We had a 17-year-old pass away in California just yesterday. We've had, I believe, I may get the statistic wrong, but almost 40% of people that are admitted to the hospital are below the age of 55, something to that effect. So this is a condition that's affecting, the whole family. And I guess for physicians out there that have young kids, what do you think? I want to focus on wellness, obviously, but of course, it's kind of got to incorporate the data. Do you think parents should be concerned about bringing this home to their family and their kids? I mean, it's our duty, but we have to protect our families. But should we find another place to stay?
Yeah.
I have a 500 square foot apartment.
Yeah.
We have one bath. There's no place for me to go. I got the cat
Right.
here, the dog here. Well, any thoughts about this? Because this can, in terms of wellness, this can really affect affect a lot.
Yeah, I think that you're absolutely right that it's different when we think that we're not putting our family at risk, and it's different when we're risking ourselves. But
Yeah.
the possibility that we could be the vector, right? The possibility that we could be the one that brings it home and hurts our family, they didn't sign up for it. We might have signed up for some level of self-sacrifice, but they didn't sign up for this. So I think that this is hard, and I think that you're right that these are one of the things. And of course, I'm not going to spend this time going through all the infectious disease stuff of removing our clothes and doing this and that. I think everybody knows about those steps. But really, I think that these are the times to be able to have honest conversations. I can tell you about my own family.
Yeah.
When I realized that I would be going to the emergency department to start providing sort of more support, not direct patient care, but more support, it was different than me working in offices. And so my family and I've had those kind of tough conversations about what does that mean. We're also in a different situation. Kansas City, real estate's a lot cheaper, so our place is a lot bigger. So I'm able to use a different bathroom than everybody. I've got my different space that I'm able to be in more. But ultimately, I think that it's important to really think about what the real risk is. And the real risk is quite low. Yesterday, our ID doctors were talking about only about a 10% risk of household transmission. That's not nearly as high as what we thought that it would have been, right? And even with kids that they're possibly getting infected, it's still not as bad as adults, right? So I think the whole thing, even in that situation, is understanding that there is some risk, but walking through the door is not a sign of death for them. How do we separate, oh my gosh, I'm going to kill my family, to there is a chance that I will bring the infection home, but I am taking these steps to ensure it won't happen. If the risk becomes higher, I rent a hotel room or whatever it means,
Right. I was watching CNN Monday night, and I heard about this last week, that the first physician on the West Coast passed away from COVID-19. A few days ago, I'm not too updated, but two emergency physicians, I believe one in New Jersey and one out west, are in the ICU with COVID-19. Do they get in the community? Do they get on the front lines? Impossible to know. This is scary. When you sign up for the military, you are willing to give your life. And in medicine, you're willing to dedicate your life, but giving your life is, I don't know that most of us signed up for that, but I think, what I've seen, and I think I don't know. It's not that I've lost faith in medicine. Our healthcare system's messed up, and EMRs, and we can talk about that all day. But I'm an outpatient doctor. I'm an outpatient clinic doctor in preventative stuff, completely the opposite end of ICU care. Every single person in my clinic unanimously decided, I want to do something. Every single person. They could have said, no, not for me. I'm going to go, oh, okay, if I'm called upon, fine. Every single person stepped up. Our entire faculty stepping up. Our residents just, yes, put me in coach, anything. I think it's giving me I don't know. I'm proud. I'm proud
Yeah.
of our field. I just um, I just know that the downstream effects of this, it's great to be proud and to be headstrong, like you said. But what if one of our family members, what if our grandparent, what if we infected someone else in our family? The guilt that we feel. I guess I'm worried about that backlash, towards the end. But I don't know. These are tough times. There's no rule book.
They are, and this gets into the ethical questions, right? Like, I have to help other people, but who does that hurt on this side? I don't know that I have great answers for that, but what I do know is that people have the right to make their own response. They
Mhm.
have the right to decide where that level is, right? Where that risk is, where that line is, and what they need to do. This is not something that I think that just because you're a doctor, there's only one way to respond. I think that different people can take different risks and be okay with that. Um, I think that also that's kind of what about the guilt that if this happens? That's still the thing is that any sentence that starts with what if
Mhm.
doesn't necessarily help us right now, right? It's one thing to plan and be logical, but right there, that statement is even, what if I emotionally hurt from this?
Mhm.
You're actually causing emotional hurt right now just by asking that question.
Right.
And you've already made your decision in it. So you've already taken that risk. So you get rid of that, as much as you can. You can't get rid of it, right? But if you can just quiet it for a second. The other thing is that once again, I think that this is just so incredibly individual. You're right that we did not sign up. We did not sign up to say, I'm willing to die for this, right? But at the same time, though, is that we've always had this element of self-sacrifice in order to do others. Frankly, all of us who did this work, we could have probably made a lot more money and done a lot more things in other fields, but we chose this field for a reason. And yes, there has been a lot of cynicism. And I'm not sitting around talking about, that this is a great thing that's happened.
Mhm.
But crisis does allow us to focus on our priorities and what really matters. And that sometimes that clarity will continue on once that crisis is over. And so do we see us responding in other ways afterwards? I think it's possible.
Right.
The other thing that I just want to say real quick about that is that most people don't know that altruism is considered a form of a defense mechanism. It's a highly developed form of a defense mechanism.
Mhm.
So empathy and compassion and serving others is actually one of the ways of being able to cope with stress, right? And so that's part of the reason why probably people are hopping up more, because to sit and watch chaos happen but not be a contributor, not being one of the helpers, is sometimes more emotionally hard than helping.
Right. That's very impactful, and I just learned a ton. I wanted to grab my phone and start taking notes. I guess I could watch this later, but just to recap again, just saying what if. I'm going to stop saying what if. That's a good start. And I guess there was a lot to unpack there, but just I guess to finalize it, if whether someone who's a physician, APP, student, anything out there in neurology, even an American Academy of Neurology staff member, right? Let's talk about that. Neurology Today staff. I mean, there's like a whole. We don't want to forget everyone else who's, we talk about the healthcare workers. We have to talk about
Yep.
the grocery
Yep.
workers, and the
Right.
pharmacists, and
Yeah.
people who are running the mass transit. I mean, that stuff hasn't shut down so that the
Yep.
healthcare workers could live and get to work, and everyone else could be okay. So if there's someone out there that's either struggling or not struggling, what are 2 or 3 tips that someone could do maybe for maybe prophylaxis to
Yep.
try to maintain wellness maybe before a problem hits?
I think that's a great question. One of them you actually just mentioned, which is empathy. It truly is, instead of, we have a tendency to think very I-based stuff, or the next level of it is our group. So I, or doctors, or I and nurse practitioners, right? But if you actually really start thinking about, one of the things for me is thinking about the security guards, that there's no screening that happens because everybody gets ID'd here because it's a pediatric hospital, right? They're in constant contact with everybody all day long. And frankly, we are in a much more financially secure situation. We're in this, we're in that, right? And they are sacrificing their their lives, right? You know, too. And so I think really being mindful of those different things, of the people who are bringing us our groceries, there is actually something therapeutic in realizing that, because then that's when you can actually start practicing gratitude. You can start practicing gratitude for the fact that, like for me, I know I'm going to have a job. Not a lot of people can say that, right? Um, yes, I'm, you know, and so many other things. I think too is limit social media consumption. And there's a difference between staying informed and being consumed. And it's almost an addictive behavior, right? So how much information do you actually have to know to do your job today? And I will guarantee you that the vast majority of us are bringing in far more of other people's fears and possibilities than we need to in order for us to function here and today. And three is really probably about realizing that social distancing should not turn into no social support. Mm-hmm. Who are our team members? How do we see each other on camera even when we can? I've been surprised by just seeing some people 6 feet away in my office that it's still nice to even be in the room with someone, right? How do we do those social supports? I think it's incredibly, incredibly important right now to keep those maintained.
Thank you so much, Jen. That was awesome. I learned a lot. I'm supposed to be sitting here asking questions, but I was actually listening and wanted to take notes. So I appreciate that for all that you're about to do and for all that you've done to help educate physicians and other healthcare providers on this topic. We appreciate it. So with that, I'll wrap up. If you want to learn more, head over to the American Academy of Neurology COVID-19 website. Neurology Today is literally publishing like literally article after article on these topics. Really terrific work. And also, we set up a new email address. So if you have topics that you want to hear about in these sorts of conversations, you want us to take a deeper dive on something, just send an email to elearning@aan.com, and we will do our best to get the topic in the queue. Jen, thanks again so much. Appreciate it.
I just wanted to say my heart's with you guys all in New York. Okay, we're all thinking about you guys.
It's bad. It's going to get worse, but we'll get through this somehow.
Yeah. All right.
Thanks so much, Jen.
Thank you.